So, Bay Area Lyme Fund was started when a number of people in our community realized they had friends or they themselves were suffering with Lyme disease. So, at the end of 2011, we formed an organization that's committed to finding a cure, but also to preventing the Lyme disease spread in our community, and then as we develop programs, hopefully in the larger Bay Area. So first of all, if you're new to Lyme disease, you might wonder what it is that the tick transmits in its bite. And it is a bacteria called Borrelia burgdorferi. The spirochete is a corkscrew shape, and it's similar to syphilis in the way its structure is. It is transmitted to people by the bite of a tick. Most often it's a deer tick. Deer ticks are very small. If you've seen a dog tick, it's a lot larger than a deer tick. You can see from this slide the fingertip, and there on the right is a female tick. To the left of the female tick is a male tick, and then the very small one there is a nymphal tick. The large female tick is only the size of a sesame seed, while the nymphal tick can be as small as a poppy seed. So even engorged, a nymphal tick will be only the size of the head of a pin. They're very difficult to detect on the body. This is why many people who develop Lyme disease they do not remember having had a tick bite at any point. One other aspect of the nymphal tick, at least in the Portola Valley, Woodside area, is that the nymphal ticks are more likely to carry Lyme. The reason for this is that we have a lizard called the blue belly lizard that appears to have something in its bloodstream that is able to kill Lyme disease. So if a nymphal tick has not ridden on the lizard, it will still be infected with the Lyme. However, an adult tick is very likely to have ridden on a lizard, and so the Lyme disease has been killed by the time it reaches the adult phase of life. This is not true on the East Coast. They do not have fence lizards on the East Coast. It is only true in the California area. So the other thing to remember about ticks is that they do have filthy mouths. They carry many other diseases. That's why there's a category of tick-borne illnesses that is studied by researchers. Some of the more common ones are Bartonella, which is depicted here to the bottom left. Babesia is the top picture. That is actually a parasite that affects the brain. And then to the right is Ehrlichia. When you can have Lyme disease along with any number of co-infections, and as you gain co-infections with the Lyme, you tend to be sicker. So if you have one co-infection, you will not be maybe as apparently ill from your Lyme disease as if you have 3 co-infections. Ticks bite in various locations. An interesting thing about ticks is they seem to definitely know which way is the upward direction, and as soon as they get onto a blade of grass or a shrub or a leg, they continue to move up, looking either for a ride, like in the case of being on a shrub or a blade of grass, or looking for a soft spot on the skin. They like crevices, they like the groin area, behind the leg, under the arm, and around the ears, neck, and back of the scalp. So children are often, you might find them bitten at a higher level than on adults, meaning they'll be up more around the head and shoulder area, just because children are shorter and the ticks make their way up there more quickly. With adults, they can be lower down. So it's important to make sure you check this sort of hot spots. The way you can avoid a bite is to stay in the middle of the path of any wooded environment or grassy environment, and also to be aware that in California, our tick season begins with cold, wet weather in the fall. This is completely different than East Coast tick season, which begins in the spring and it extends through the fall. It's because their wet weather is during those months. Our wet weather, even though it's cold, we don't really fall below 40 degrees, and so the ticks remain very active through the winter time. Our nymphal tick season is in April and May, and that's when those very, very tiny ticks are around. It's important not to allow your children to climb through grasses, shrubs, and roll around in moist, dead leaves. This is where the nymphal ticks like to be. And during the dry and wet weather, your ticks are still around. The one thing that ticks do not like is dry, hot weather. They become desiccated. That's really one of the only good ways to kill a tick is with dry hotness. But during this weather, you can still find ticks in moist places, which would be the leaf litter or under logs and on tree trunks. So it is a good idea to avoid sitting or leaning against trees during any time, really. So there are other ways to avoid ticks if you're camping or in area with overgrowth is to use repellents, to spray your feet and lower parts of your body with DEET. You can also use permethrin, which is sold in hiking stores like REI in our local area of the Bay Area. They are you are able to soak your clothes. So if you're going on a trip, you can use the permethrin and soak your clothes, and it will last for 6 weeks or 6 washes, whichever comes first. It is a good idea to use Frontline on your pets so that the ticks don't bite your animals. Dogs can get Lyme disease, and it helps bring them to the surface so that they drop off. So make sure that you are looking at your dog or cat, even 2-3 hours after they've been outside, if they've been in the shrubs. It's also a good idea not to have the animal sleeping on your bed, especially during tick season, because if the ticks kind of rise up from the skin area, they can drop onto your bedding. If you do get bitten, it is important to remove the tick properly. You don't want to squeeze the body of the tick. That is like expressing a balloon full of infectant into the wound. So what you want to do is get tweezers. You'll see in this image that they have a slant on this particular type of tweezer, which makes it much easier for viewing where you're grabbing the tick. And you want to get it below the mouth parts as much as possible. And then you just pull firmly and remove the tick from the bite. It is a good idea to disinfect the bite site, and then you can place the tick into a bag with some moistened cotton balls or toweling, again, because ticks, they tend to desiccate. And certain places have a harder time testing them if you decide to have your tick tested. If the tick has died, they just have a harder time getting the genetic material of the Lyme disease. One of the big questions is if you live in an area or you have the type of job that brings you in contact with ticks, how are you really going to have every tick tested? It seems rather cumbersome. So the best idea is to figure out if you need to have the tick tested by asking yourself some questions. If you pick up the tick in a chaparral area that's dry and has lots of fence lizards, it is possible that the infection level is lower than if you are in an area where it's not as sunny, there's no fence lizards, and there's more newts and that sort of thing. If it's the latter place, it could have higher infection levels. So if you want to be safe, you may decide to have the tick tested. The other option is to just keep an eye on how you feel after a bite, and if you start to develop flu symptoms, then you should go and get treatment for early Lyme disease. So if you do decide to test a tick, the best place in our area, there's 2 places. One place, if the tick is alive, is to bring it to the San Mateo County Mosquito and Vector Control at 1351 Rollins Road in Burlingame. And there's no cost to testing a tick there. But they do not test for co-infections. It's for Lyme disease alone. If you have the tick and it's dead or alive, you can bring it to IGeneX, which is at 797 San Antonio Road in Palo Alto. There is a cost. It ranges. I'm sure, at the moment it's about $65. But they can also test for the co-infections that can often come along with the Lyme disease and the tick. If you have Lyme disease transmitted to you from the bite, there are early symptoms. A lot of people hear about the target rash, this very famous symptom of early Lyme. If you have this rash, you definitely have Lyme disease. So it is absolutely diagnostic for the transmission of the disease, and you should talk to your doctor about getting early Lyme treatment, and make sure you speak with a doctor who is Lyme literate. Many doctors are not well schooled on Lyme disease in California. It's a relatively newly treated disease in our area. So you want to make sure that you get good advice on that. It's generally recognized that 10 days of antibiotics is not enough in the Lyme community. Not all infections from the Lyme disease show a rash, and it's very important to realize that you can be infected with the Lyme disease if you do not have a rash. And so really look out for the flu symptoms. If you get aches, fever, and exhaustion within a week or two after the bite, then is really a possibility of having Lyme disease. The tricky thing in California is that our Lyme season, tick season, coincides with our flu season. So it's maybe good to keep a diary of symptoms and whatnot to try to tease out whether you have the flu or early Lyme transmission. After the early symptoms, the flu symptoms abate a little bit or lessen, and you kind of go along for maybe a few months before you start developing some other symptoms that are characteristic of late Lyme disease. Some of these are Bell's palsy, which is a partial facial paralysis. You can get heart palpitations. Extreme fatigue is very common. You can feel sick, nauseous. Stiff or aching neck is very common. Dizziness, shortness of breath. You can have trouble concentrating and what's called executive functioning, which is prioritizing things like your schedule and sort of problem solving, like what's the first step, what's the second step. When you go through those things, it can cause you to feel anxiety because it seems to be hard to sort out. Also, irritability is very common with late Lyme, as well as depression. Forgetfulness, word choices can be difficult to get, trying to get the right word for what you mean and recalling that. Headache, new onset of migraines, of course, joint pain and swelling. This is another very common symptom that's on the East Coast, maybe less so on the West Coast. We tend to have more of a neurological Lyme disease on the West Coast, which would affect more of your cognitive functioning. And then there's other neuropathy type of symptoms such as tingling, shooting pain, feeling like you're being stabbed with a needle. They tend to be in the extremities, like the feet or hands. You can have partial numbness and that sort of thing. There are other symptoms as well, but I think that covers a pretty good list. So when you get diagnosed by a doctor, it's very common for people who have Lyme disease to be sort of moving in and out of doctors looking for help for quite some time. The reason for this is that it is a great imitator of many different diseases. Many of them are chronic diseases such as fibromyalgia, chronic fatigue, cardiac conditions. Some Lyme doctors say that their Lyme patients are the most cardiac worked up patients ever because they usually spend a lot of time trying to figure out what their heart ailment is before they realize it's not a heart ailment, that it's something else. ALS, multiple sclerosis, Parkinson's, or even mental illness can also be misdiagnosed for Lyme disease. The other thing that you want to be aware of is that the blood testing can sometimes come back negative when you are actually positive for Lyme disease. This is a good reason to go to a doctor who has Lyme literacy. It's extremely important because when they do the clinical exam, they will test certain telltale areas such as the eyes and coordination, reflexes that often betray a Lyme disease infection. Now, with all of that, the one thing that we have as a goal at Bay Area Lyme Fund is that we live in a rural area with a lot of trees and animals and bird life. We love to be in the outdoors, and it's really important for us to continue enjoying the outdoors. But when we go there, that we are safe, that we move through our environment safely and don't needlessly expose ourselves to tick bites, and that if we are bitten, that we know exactly what the risks are and how to protect ourselves from further development of any sort of Lyme disease. So just make sure that if you are bitten, get very conversant with what the early symptoms are, and if you develop them, get early treatment. With that, you can avoid a lot of prolonged illness and continue a healthy and productive life.